So Critical Path Institute it was started here in Arizona by our founder, Dr. Raymond Woosley, who was actually the dean of the College of Medicine at University of Arizona. He saw the vision that was created by Janet Woodcock at FDA to really bring to life the Critical Path Initiative, which was defined and released in 2004. So this entity of CPATH is really the application of that Critical Path Initiative. And so over the years, we're now 18 years strong. Over the years, the notoriety and reputation that CPATH has been able to establish on a global stage really only helps to bring positive attention to the state of Arizona. Not only do we partner with the FDA, we also will collaborate with European Medicines Agency and other international regulatory agencies to really ensure that the solutions that are needed to be able to get therapies to patients in need are done so with the input from the various regulators that are really focused on those particular therapeutic areas. As part of the state of Arizona, and as CPATH really, being having a firm foundation here in the state of Arizona, we have grown tremendously, and so we have brought additional talent into the state of Arizona, and I would say highly technical talent to the state of Arizona. We've also done quite a bit of recruiting and support from educational support for college students here in Arizona and graduate students as we bring them into the organization, as we offer fellowships and internships, postdocs. So there's, that from a workforce development standpoint, CPATH really has benefited from the tremendous talent that Arizona schools have produced. CPATH also has a regulatory science certificate program. It's a graduate level certificate program that was developed in collaboration with the University of Arizona College of Law. And so we find that incredibly rewarding, and also not only does it, of course, benefit those individuals who are getting that additional education in regulatory science, but what that then brings forward for the broader therapeutic development ecosystem that is beneficial not only locally but nationally and globally. And I would say maybe most importantly is the fact that here in Arizona, the demographics that we have and the therapeutic areas where we have public-private partnerships or these consortium where we're really trying to facilitate opportunities to get therapies to patients in need. We have a number of partnerships that touch on the demographics that are really important here too in Arizona. So we have a consortium that focuses on the development of therapies for Alzheimer's disease patients, for Parkinson's disease patients. We have a number of efforts that are focused on patients with rare diseases and pediatrics. And so while these consortia not only will benefit, of course, patients in need wherever they may live. So specifically here in Arizona, the work that we do day in and day out has a tremendous opportunity to impact our neighbors, our broader community. And it's rewarding to be part of an organization that is doing so much good, not only on a national or global stage, but within the state of Arizona.